Hello. Today's lecture is going to be on communication. So the course objectives that we're meeting today would be demonstrating effective communication techniques used across the lifespan and demonstrating therapeutic communication techniques across the lifespan. And the weekly learning objectives are to define types of communication, verbal, nonverbal, and to be able to distinguish between social and therapeutic communication, to identify at least 3 blocks to communication, and to be able to compare and contrast techniques to enhance communication. And the reason we're talking about communication in a growth and development course is because we need to learn how to communicate with infants, with children, with adolescents, with adults, with the elderly, and amongst ourselves. So if we can figure out the best ways to communicate, to understand verbal, nonverbal communication, and work on ways to enhance our communication, that will help us all in the long run. So when you think about communication, think about talking with someone. There's a sender and a receiver, right? Like I'm communicating with you, I'm the sender, you're the receiver. The method is the way that the message is being sent. So in this example, this is a recording that you're watching. And then the message that I'm sending is this lesson on communication. And so then you as the receiver will interpret the message and then provide feedback or your response to it. And that could be in the form of questions. You might think of things, examples in your past where you've had good communications with others or poor communications with others. The types of communication, there's verbal, which is what I'm doing right now. I'm speaking to you and you're listening. And there also are types of nonverbal communication, which would be the use of body language. And there is a video which I posted on the website in the course that is a clip from the show Friends that shows different types of nonverbal communication that they all use and some of the misunderstandings that ensue because of it. Nonverbal would be, physical appearance and dress. So when you look at someone, do you make assumptions based on what they look like? Do you make certain facial expressions? Any particular gestures that you use all the time? It's good to try and make eye contact, your tone of voice, or your pitch if it's too high. And then sometimes we can use touch or even silence. Sometimes silence is a good thing because it allows the other person to speak as much as they want about as much as they want or whatever they don't want. There are different personality types. There's the passive or unassertive person, which is shown here in this picture by the gentleman in the blue, who is the passive person. Looks like he's kind of afraid. He's sort of shaking a little bit, not quite sure what to say or how to say it. There's also the aggressive person who's on the right-hand side in the red shirt, and he looks pretty angry to me, and he's shaking his fist and he wants to make his point. But really the best way would be to be the assertive person, like the person who is in the middle, the assertive person in the yellow shirt, who's kind of smiling and he's making eye contact and saying what he needs to say and listening. And that's what we all strive to do. When we talk about different levels of communication, there's social communication and therapeutic communication. So this slide is talking about social communication. And that's what we do when we talk to each other, when we have a conversation, when we ask each other, how'd your day go? What's going on in class today? What are you doing for the summer? Those types of things. And there's different ways of doing that nowadays. The first picture shows a group of young adults sort of in a semicircle. They're talking. They look interested. They're making eye contact. The lady in the teal shirt is sort of leaning into the group. The gentleman to her left is also leaning into the conversation. And that's a good thing. You feel like you're being heard and people will contribute to the conversation. The picture on the far right, the 3 little boys just look like they're having a great time. They're telling each other secrets and they're laughing and they're really enjoying themselves. And then if you contrast that with the picture on the bottom, there's 4 teenagers and looks to me like they're at the beach or near the ocean and they're all on their phones and not looking at each other, not talking to each other. one student's even told me, well, they're texting each other, but they're all next to each other. So they're not communicating very well. They don't have that interaction that we all long to have with each other. So those are just some different examples. And then when you talk about therapeutic communication, I think the best way to think of that is that therapeutic communication is purposeful communication. There's a reason that you're having this conversation. There's either a point you're trying to get across, or support someone, listen to them, and usually there's a goal. It's purposeful communication. So there's some type of goal to that conversation. So for example, on the left-hand side, it looks like it's a nurse talking to her patient, a gentleman lying in bed there, and she's making eye contact and he's making eye contact. And I would think that she's probably, looks like she might be taking his pulse. So she's, you know, trying to accomplish that, see how he's feeling, what his vital signs are. And then the gentleman, the picture on the right-hand side, looks to be a nurse who's sitting there at the same level almost as the patient who's sitting up in bed, and they're talking, and it looks like they're having a pretty deep conversation. There's some hand gestures there, and they're making eye contact with each other. And it could be that the nurse is taking a health history, or perhaps the nurse is doing some discharge teaching, things like that. So there's, maybe he's doing an assessment, trying to see how his patient is feeling or make him feel better. And then the picture in the middle is the cute little frog that says, "I see." And how did that make you feel? Because we ask that a lot. How do you feel? How do you feel about that? Those types of things. So why do we use therapeutic communication? Because that's something as a healthcare professional that you will be learning how to do, and you probably already do it. The functions can include creating an understanding. So you're trying to get a thought across, and somebody understands you. For example, discharge teaching. Say you want the person to, I don't know, walk around the block once a day. That's the goal. And so you're going to create an understanding with that patient that they need to do that. They need the exercise. It will help them with their breathing. It will help them lose weight, those types of things. You're also trying to perhaps decrease anxiety. So sometimes people that are getting ready to go to surgery, they're very anxious. And so you can talk to them, you know, tell me how you feel. You know, I'm sorry to hear that. What can I do to help? What has helped you in the past deal with anxiety? Providing information, for example, an assessment, an intake assessment, or when you're doing a pain assessment, those types of things to gather information. And then also to develop trust, because as healthcare providers, we would hope that our patients would trust us, but we also want our coworkers, our peers, physicians, other people, other professionals to trust us as well, just as we would like to trust them. So that helps, therapeutic communication can help to develop trust as well. So the different components of therapeutic communication, because you might say to yourself, well, I know how to talk to somebody, but how in the world do I have a therapeutic conversation? Well, here's a list of some things that you could do. So listening is, people say, well, listening and hearing are the same thing. Well, not necessarily. I can hear you say something, but if I'm really listening to what you're saying, then I'm involved and I'm hearing what you're saying. I'm listening. I could tell you, I could repeat back to you what you said. There's a genuineness about the conversation. You're really involved with the eye contact and being genuine with your questions. There's some warmth involved. You're very attentive to the person that you're speaking with. And you also have a positive regard for them, and also can feel empathy, not sympathy, but empathy. You can put yourself in their shoes and imagine what it would be like to feel like them, to feel what they're going through. And so those are some tips that could help you with therapeutic communication. So when we're going to have a conversation with our patient, or even when we're having a conversation with each other, there are many factors that can affect communication. So you can have a congruence or incongruence, agreement between the verbal and the nonverbal language. excuse me, which the Friends video does bring out when you watch that. You might say something, but if you're saying it and you're not making eye contact, or you're kind of looking bored, or you have a high-pitched voice, oh really, yes, I agree, totally. You know, that cannot, you might not develop trust with that person. You might not think that what they're saying is true. The time and setting, when and where the communication takes place. So I don't know if you can put yourself in the shoes of being a patient, but the discharge planning is supposed to happen on admission. So you should be working to this goal of discharge. But oftentimes what happens is nobody's really done a lot of the teaching, and now there's a discharge order. And so you have to get all that teaching done while the patient really wants to go home and doesn't necessarily want to hear everything that you have to say. So you have to make sure that it's the right time, and there is a good setting where there's not going to be interruptions, and the right people are there that need to be there, the family, that type of thing. And then there's also proxemics. So proxemics means being in proximity or near or far away from somebody. So it's interesting in this day and age, because we have to stay about 6 feet apart. So it's very difficult for us to get closer together to have a more therapeutic conversation. But if we wear our masks, then that can help. In the hospital, we are able to get closer to our patients, and things are starting to open up now. But sometimes if you're very far away, it's harder to convey the message that you would like to convey. There's also something called bias, or your biases, prejudices, or negative beliefs. Again, this is a hot topic right now. I always tell my students, when you are walking into your patient's room, regardless of what your personal beliefs are, you have to leave them at the door, because you are there to take care of your patient and see things from their point of view and try and help them the best that you can. Doesn't mean you can't have different ideas and thoughts about things than what your patient has. You just need to leave your personal prejudices at the door. And then physical handicaps, if someone is visually impaired or they have a hearing impairment, even if they're a paraplegic or have difficulty with movement, things like that, that can also be a factor that affects communication. Many times people think that if a person has difficulty hearing, that if they just speak a little louder, that the person will be able to understand them and hear them. However, it's better to speak more slowly and try and make your point that way, and then ask clarifying questions, or ask if the person understood what you were trying to say. There are some blocks to communication. This is something that you'll need to know. There's different things that a person, the sender, can say that can really turn the receiver off from trying to have a conversation. Or during the conversation, the receiver can say something as well that could make the sender not want to, again, participate in the conversation. So the blocks to communication, one is called belittling, where you make the other person feel less than what they should feel. Disagreeing, so you can disagree with someone, but depending on how you do it, sometimes you can just agree to disagree, but you don't necessarily want to get into an argument, especially if you're trying to have a therapeutic conversation. Sometimes agreeing can be a block to communication. Sometimes I've been with patients and I've been explaining things or doing some discharge teaching, and they keep nodding their head. Yes. Mm-hmm. Do you understand? Yes. And then you leave the room and another nurse walks in and they ask all the questions that you just gave them the answer to. So you have to sort of keep an eye if somebody is agreeing and think of another way to ask the question to see if they understand what you're saying. Defending is being on the defensive. There's an example here where a patient would say something like, the nurses were very slow answering my call light last night. And the nurse says, well, I don't know how you can say that. This floor has the best nurses in the hospital. So it doesn't sound like the nurse was really listening to what the patient was saying, or to even ask more clarifying questions. Oh, what makes you say that? I'm so sorry to hear that. Tell me more. Those are some good things that you can say. And then stereotyping, again, you don't want to do that in the conversation. And then more blocks to communication, false reassurance. So that's something in healthcare that you might find yourself slipping into. Oh, don't worry, everything will be okay. You know, things will get better. But unless you absolutely know that, then you shouldn't really give false hope or false reassurance. Many times the patient will ask you, well, if you were me, what would you do? Or what pediatrician would you use? Or which gynecologist do you use? And actually, we can't really give them an answer to that. You know, we could point them to some resources. We could point them to a list of pediatricians or a website that lists different pediatricians, or like a Yelp site or something that rates them. But we can't really say, oh, well, I go to Dr. So-and-so. Not, you know, if I were in your position, I would get a second opinion. No, we're not really allowed to do that. Sometimes changing the subject can be seen as a block to communication. The person's trying to communicate, have this conversation with you, and then all of a sudden you change the topic, or they change the topic. Well, that means they're not really listening and getting into the conversation. They're changing it to something else to avoid the conversation. Because maybe they're uncomfortable or they don't understand what you're asking them. Closed-ended questions, those are generally yes or no questions. Do you like your strawberry ice cream? Yes, that's a yes or no question. Are you having pain? Yes, it's a yes or no question. How do you feel today? Well, my stomach hurts a little bit. Oh, could you tell me more? Where is it? Can you show me where it hurts? How long have you had the pain? Is it radiating? Is it sharp? Is it dull? So if you can ask what's called an open-ended question, that can give you more information. Why questions can be another block to communication. Continuously asking, like think of the 2-year-old. Well, why? Why is the sky blue? Why do we have to go here? Why do we have to do that? Can be annoying and not allow the people to continue the conversation. You can say something to the effect of, tell me why you feel that way, as long as you're not starting every single sentence with, well, why? And the same with probing, to continue to go to deeper into the conversation, but too personal or into areas that don't really have to do with what you're trying to do at the time, the goal that you're trying to accomplish at the time. And then different techniques to enhance communication. So we have blocks, things that can make the conversation not go well. So how can we, as healthcare professionals, speaking to each other and speaking with patients, how can we enhance the communication? How can we make it better? So the picture that's given in this slide is, can you say that again, please? I don't understand. And the person says, sure. So I would much rather that someone ask me if I could say something again or clarify or say it in a different way than just assuming they know what I said and then go off and do the wrong thing. So techniques you can use to enhance communication, you can give information like explaining things, you can validate, which is something along the lines of, so what I heard you say is that I need to write at least 5 sentences for it to be a paragraph. And then I would say yes, or clarifying again. So we need to write at least 100 words in our response, and then I would say yes or no. Reflecting, we do a lot of that as healthcare professionals. So reflecting on what we've just done, what we've just said. You can reflect for a while, you can come back, think about maybe you've had this happen in a situation before. Paraphrasing is another enhancement technique where you can sort of summarize what the person is saying. Asking broad questions, that's kind of like open-ended questions, asking big questions, and you can sort of start up here and then kind of hone it down. That's not the same as probing. Probing is a more insensitive way to do it, but asking broad questions or using general leading questions is good, and then you can pare it down to what you're really, the information that you're really trying to get to. You're building a relationship in that process. Making an observation. Oh, well, it looks like you're feeling good today. You have a smile on your face. I think that would be making an observation that can help to enhance communication, as opposed to now saying, gosh, looks like you didn't get any sleep last night is an observation, but it's not necessarily a very positive one. And so these are just a couple cartoons, again, talking about enhancing communication. These are focusing on humor. So the three surgeons at the table and the ones holding the feet of the patient who's fallen on the floor. And that is why we lift on three, right? Communication. And then the picture of the cartoon on the right-hand side, the two nurses in the doorway, the nurse manager says, and we have an excellent on-the-job training program. Nancy here will be precepting you in effective communication techniques. And it just so happens that Nancy here is punching a punching bag pretty hard. So using humor is a good thing, although it is good to gauge the person that you're speaking to, the receiver, to see if that is a technique that works for them to enhance communication. Offering yourself, giving some examples, not going too personally, but you can offer self, you know, I can take some time, I can sit with you here, sitting at the same level with the patient, as well is another, could also be known as a focusing technique, where you're really focusing, making eye contact, being at the same level as the patient. And those are things that will, that can enhance communication. So that's a wrap for this particular lesson on communication. Some key points to remember. You should know the communication process, the members involved, the sender, receiver, feedback, the message. Be able to give examples of nonverbal communication, know the difference between social and therapeutic communication, be able to identify examples of blocks to communication. So for example, if we said, you know, belittling, could you give an example of what someone would say that was an example of that? And then be able to discuss techniques that enhance communication and how you personally have used them in the past. So those would be the key points to know. So if you have any questions, feel free to leave them in the general question Q&A discussion forum, and I will see you in the next lesson.